Welcome to the Money Mastermind Show. Let's talk money.
And welcome to the Money Mastermind Show. Healthcare costs aren't just high. They can be downright scary. Tonight we're joined by Jennifer Fitzgerald of Policy Genius. Welcome to our show, Jennifer.
Thanks for having me. Glad to be here.
Thanks for coming and helping us out here. The rest of the Money Mastermind Show, as most people should be aware by now, but in case you're not, we have Miranda Marquit of Planting Money Seeds, Peter Anderson of Bible Money Matters, Tom Drake of the Canadian Finance Blog, and Kyle Prevost of youngandthrifty.ca. He's not here tonight, but he is part of our panel. And I'm Glenn Craig of Free From Broke, your moderator tonight. So before we start, we do have an event page. If you have any questions regarding healthcare costs, how to cut them down, how to get by on it, go to our event page, ask on our app, and we'd be glad to answer your questions. So Jennifer, healthcare costs are rising at an incredible rate. We hear stories all the time about how the costs are just astronomical. How can the average person stay afloat with all these rising costs?
Yeah, it's a great question and one that's a big concern. For the last 10, 15 years, healthcare costs have risen faster than inflation, right? So it's a big concern, particularly for middle-class consumers, and especially for people who don't have health insurance through their employer and have to figure out how to get their own health insurance, right, and navigate that minefield. So the first piece of advice I like to give folks is to figure out what kind of healthcare consumer you are, right? Are you the kind that very rarely goes to the doctor and just wants it there as a safety net in case, something catastrophic happens? Or, do you have conditions that you have to manage? You're going to be a more frequent consumer. You have children, who may need to go to the doctor more often. So figure out what type of health consumer you are as the first step in figuring out your healthcare costs, right? So if you are a low frequency consumer, right? So somebody who's young, doesn't have young kids to worry about, and basically just goes if it's like, broken arm and I have to see a doctor, then you should look at high deductible healthcare plans, right? So the deductible is basically what you have to contribute to your medical expenses before insurance kicks in. And the higher the deductible, meaning the more risk that you bear, the lower your monthly premiums are, right? So that's kind of the trade-off. So high deductible means lower premiums.
Similar to like what a car insurance would be.
Exactly. So it's the exact same relationship with car insurance, right? So the more risk you bear because you think you are, going to use the insurance less, the lower your fixed cost is going to be. On the flip side, if you want a lower deductible, meaning you want your insurance to pay, from the first dollar of healthcare expenses, you're going to pay for that. The premiums are going to be higher. But you're going to make up for that because you're not going to have, some big out-of-pocket costs. So it's really around figuring out, how frequently you're going to go use the healthcare system and choosing a plan accordingly.
Is it? I mean, I get the whole, if you have kids, obviously your healthcare costs are going to be different, or maybe if you're a little bit older. Is it fair though to say that you're an infrequent person? Like, I mean, anything can happen.
Right.
Like, shouldn't we be prepared for that?
You should. Absolutely. So
you could wake up and then all of a sudden you have an appendix burst and now you've got like a $75,000 hospital bill waiting for you or some craziness like that.
Exactly. Now, the nice thing, and one of the things that the Affordable Care Act has done for folks, is they have the law has placed a limit on the maximum out-of-pocket you can spend, right? So if you have insurance, even a high deductible plan, there's going to be a cap on what you're accountable for, right? So before the Affordable Care Act, there used to be no limits on that, right? So if you had a healthcare plan that didn't cover a lot or had a very low ceiling on what it would contribute, you could be in debt for, hundreds of thousands of dollars potentially if it's something catastrophic or something like cancer. Now there are limits on that. And so, most plans are going to really max out at about $6,000 for an individual in terms of out-of-pocket expenses. For a family, it's usually double that, around 12 or 13. So still a lot of money, but it's not the astronomical levels that it was before.
And I think if somebody's not careful, that's still a cost that could pretty much wipe out a lot of people.
It is. So, we like to encourage folks, it might be tempting to go for the high deductible plan because the premiums are lower, but, if you, one trip to the emergency room, you'll hit the deductible typically, right? That's the average cost of an emergency room visit is $10,000. So, if you've got a $6,000 deductible plan, consider whether you can afford that, right? But there are other things that you can do to keep those costs in control. If you opt for a high deductible plan, which is anything with a deductible over $1,000, you can sign up for a health savings account, which allows you to contribute pre-tax dollars.
That's my favorite. I love the health savings account. It's my most favorite thing.
It's a great strategy and one that's underused by a lot of folks, right? So you contribute pre-tax dollars, which means your taxable income goes down, which is great. Lower tax bill come April. And you could use it for any qualified medical expense, right? So you can use it on premiums, deductibles, co-pays, prescription drugs. So, on both sides of the equation, it'll help you keep your costs down. If you have an employer, they'll often create a flexible spending account, which is employer owned. Same deal, except the employer owns it. But you can't roll over any money that you don't use by the end of the year. So that's just one, caveat around the flexible spending account.
Yeah.
Is it still completely lose it or use it? I mean, I remember something. It's been a while since I've had one where there was a certain amount you possibly could roll over, or is it you have to use the whole thing?
The HSAs you can roll over. The FSAs, you got to use it or lose it.
They extended the deadline for some of the money in the FSA so that you can use it till later in the year, and a certain amount of it can be used for later in the year, but it's still ultimately, at the very end of the day, it's still a use it or lose it situation.
Yeah.
And I would like to go back and point out too, at the health savings account, the HSA, I know all these letters just being thrown at people, but I would like to go back and point out that the health savings account, the one that's yours, that you own, that you can take with you, and that rolls over, that one is also, the money is grows tax-free, as well as being tax deductible, as long as you use it for those medical expenses. So even when you take the money out, you're still not going to be taxed on it unless you're using it for something that's unqualified.
That's a great point. Yep.
And where, I mean, Miranda, you just said the money is growing. Where does that money sit? Because I know a lot of people just for IRAs, and I know that's a different subject, they get very confused about that. And a lot of people say, well, I'll invest in an IRA. Give me this IRA. And they don't understand that it really encompasses something different. So what do we mean really by an HSA? Like, where does that money go? How is it growing? What are we really putting that money into?
Well, it depends on where you're at and who's your custodian. For instance, if you do it through your employer, like Jennifer was talking about, a lot of the time it just goes into like a regular kind of bank account, and it just sits there, and it's mostly growing at a cash rate, your cash market rate. But there are custodians that you can find where once you hit $2,000 in your HSA, you can actually then take any amount above that and put it into like an index fund. So you can actually grow it faster if you want, depending on where you're holding it. So, and there are private companies out there where you can, and we can put them in the show notes, where you can go and you can look and you can get an HSA that grows a little bit faster.
Okay, good to know.
But then, of course, you do have to realize that you're at the risk of loss as well. So you need to check your risk tolerance and figure out where you're at.
And if you're like my family, you have your HSA and you can't build up anything in it because you keep getting sick going with it. In the emergency room, like Jennifer was saying, we've already maxed out our family $6,000 deductible already this year. So right now we're actually going in for all the doctor's appointments we can imagine, just because, hey, we can't. It's all free at this point. We've reached our deductible. So.
Hit the deductible.
Yeah.
Nice.
So it sounds like with these particular plans, there is a bit of planning on the person's side before you put the money into it. You have to kind of be able to estimate what type of costs you might have. How does a person go about that? I mean, I remember just for an FSA, it wasn't particularly a lot of money because I didn't want to lose it, but I did have to think about things like maybe prescriptions or what types of doctor's visits, or if I was going to particularly buy something that might be part of the plan. So like one year I knew I was buying glasses, so I was able to put money towards that. So, but really, how does a person get their head around planning for that? In any of those plans?
So the easy thing is, just take a look at your consumption over the past couple of years. If you're organized and you keep track of your bills, and I know a lot of us don't, you'll have to just kind of sit and go through that. If you use any centralized appointment making software like ZocDoc, which I use to, find doctors, make appointments, make sure they take my insurance, I can actually go back over the course of a year and see actually how many appointments I did make. Were they with my general care physician? Were they with a specialist? So that's kind of a good record keeping to see, how frequently I've actually been to the doctor. You should be able to, from your bills from the previous year, look to see what prescriptions you filled. Fortunately, there's no easy way to do it. The onus is kind of on you to be organized and keep track of those bills. But you should have a general sense of what kind of consumer that you are and whether you have any chronic conditions that you have to think about and manage.
One thing I think about too is I think a lot of people are in for a rude awakening in this coming year just because of the rate increases that are going to be coming down the pipe. We've been in the Obamacare for a couple of years now, and now the insurers are starting to see just what the true costs are and everything. And I was reading something earlier today about how Blue Cross and Blue Shield plans, where market leaders in a lot of the states, are seeking rate increases that, for example, are average 23% in Illinois, 25% in North Carolina, 31% in Oklahoma, 36% in Tennessee, and here in my home state of Minnesota, 54%. So got that to look forward to. But even if people are planning ahead and they're looking back at what their costs have been in previous years, they have to take into account, hey, your rates are probably going to be going up in this coming year as well.
Right.
Now, you're talking about the rates if you have an ACA account or just all across the board? Like, who really needs to look out for this?
Well, I think that was for the Obamacare eligible plans, the qualified health plans. That means you would be qualified for tax credits and so forth as well. But
those are some pretty significant jumps.
Yeah, it's also across the board, even for employer-sponsored health insurance. Those costs are going up as well. So if you work for an employer where you have to make contributions toward your premium, which is the case for most folks, those will typically be increasing as well.
Well, and I think it's worth everybody seems to act like suddenly, like all of a sudden, out of nowhere, the last 2 years, we've suddenly seen these rate increases. The reality is we've been seeing rate increases for health insurance every single year for, I don't know, since the beginning of time.
Yeah.
Right? I mean, since they decided to make it a for-profit situation back in, what was it, the 70s? Basically, we've had health insurance increases since then. I think they've been slower. I think the last couple of years they've been slower, and so I think maybe this coming year, I guess they're catching back up to where they used to be.
Now, what drives these increases? Because I can kind of get my head around, let's say, mortgage increases or student loan increases, but what is it that causes health insurance to go up so much?
Any number of things. So the big drivers are, the rising cost of healthcare technology, right? So the new procedures, expensive procedures, new prescription drugs, right? So before they, the patent wears off and there's generic versions, that'll drive the cost up as well, particularly for advanced conditions that can command higher drug prices. Because of the way that the payer system works in the U.S., where you've got the patient, you've got the doctor, you've got the insurance company, and then a lot of times you've got the employer in there as well. You've got a lot of stakeholders, sometimes with misaligned incentives, so that can, encourage people to, go to the doctor more often when they don't need to, or people are overinsured a lot. So young people who work for employers, like my old employer, we had very rich healthcare benefits, so it encouraged younger, healthier people to go to use the system more often because we had great health insurance, right? So there's just a lot of misaligned incentives as well that drives up consumption. One thing that doctors like to talk about as well is defensive medicine, right? In the, kind of system of litigation and lawsuits and ordering tests to kind of CYA, that'll drive up costs as well. So, there's any number of these factors that drive it up. And also, our population's getting older, people are living longer, so you've got the right tail of the population using a lot of expensive healthcare procedures and prescription drugs. So, kind of all these factors create a perfect storm for costs continuing to go up every year.
Right, and let's not forget that they've got to return value to their shareholders, and we've got CEOs with $100 million. Sorry, I'm yelling again, but we can't forget that the CEOs need to make $100 or $200 million a year. We can't forget that as well.
And I can't help but think of the story, and it's a little tangential here, of the was it somebody in a hedge fund that bought the rights to a medicine and then just
AIDS drug? Yeah, it's AIDS medication.
Yeah, that just seems all sorts of icky and bad.
Yeah.
Well, and I mean, and here I go yelling again because that's what I do when we talk about healthcare.
That's why we have a panel, when we need to yell.
Miranda yells about things. No, well, I mean, just back with the drugs, and they're always whining about research and development, but when you look at their marketing budgets are what is it? I think it was like 75% of their budget goes to marketing, and I think 15 to 20% goes to R&D. So there you go.
It's an interesting.
We're in a for-profit system where all these, like Jennifer was talking, all these stakeholders need to make their money.
Yeah, if you talk to folks, I have a lot of European colleagues, and they're like, I never saw, primetime commercials for prescription drugs till I came to America. That's crazy.
Well, I think what's really crazy is that when you watch these commercials, you don't even know what they're for.
Nope.
All you do is just see this kind of like cloudy sort of haze, and then like the last part of the whole commercial. It seems like most of the commercial is just, this is what could happen to you if you use it, which isn't good. It might do this for you, which is good, but then all this stuff can happen that's bad.
Just reminds me. We went to the doctor to have a wart removed from the bottom of my son's foot because he was complaining about it, and they did the nitrogen spray on it, but it was so uncomfortable and so painful that he was like, "No, this is worse. This is worse. The cure is worse than the affliction." And that's what it seems like with a lot of these drugs, that the cure is worse than what you're suffering from.
And we're paying through the nose for it. But we're maybe getting a little off topic here. That's, I think, a whole other political episode that we could be talking about. So this time of the year, and just in general, people shop for health insurance. Maybe they're looking to switch insurance because maybe they can do that now with open enrollments. Or maybe there's people who they're on their own for the first time. What should people look for? Like, how do they even start to go about trying to pick something? Like, I had a job where maybe I only had 3 choices.
Mm-hmm.
So that was pretty easy. But I know other places you can get a long list of like 10 different plans to sign up for, and it's dizzying. And then for people who aren't even covered by employers, if you're going out on your own, where do you even start?
Sure. So the first thing that I'll tell folks is figure out what you'd be comfortable spending monthly in terms of premiums, right? So the average American spends around 5% of their income on health insurance premiums. So you can use that as a rule of thumb. The unaffordability threshold that the federal government uses is around 9.5%. So use between 5 and 9 as what you can anticipate spending on health insurance premiums, right? So if you're shopping for yourself on the Affordable Care Act exchanges, things are arranged by the metal tier, so platinum, gold, silver, bronze. So you can actually look at the expected cost of each tier, figure out where you want to play. We did a study last year that 5%, if you make $70K a year, usually lands you squarely in the silver tier. There are some high deductibles in the silver tier, but you can get good coverage there. There are typically 2 knockout criteria. So once you kind of figure out what you want to pay, 2 knockout criteria that folks should consider, which is, do you have any doctors that you must keep, right? So like, I refuse to take any plan that doesn't accept these, that my doctors don't accept, in which case that'll kind of narrow it down pretty quickly, right? So confirm with your doctors that you really want to keep, what plans that they take, and then, from there, usually most providers will have different tier plans, right? A silver or a gold option. Same thing for your prescription drugs. So if there's any prescription drugs that you need to keep, figure out what the coverage level is among the different plans. So those are kind of the two knockout criteria. Then it's just really around kind of optimizing for cost there, right? So most plans now will show kind of the total expected cost in a year, including premiums, the deductible, and assuming, what's the average you could expect to pay, what's the most that you could pay for healthcare in a given year, and you just kind of have to figure out what you're comfortable with in terms of the risk that you're going to bear and your monthly costs. There's kind of an alphabet soup of different types of plans, right? You'll see HMO, EPO, PPO, and you're like, what the heck do these all mean? Basically, PPOs are going to be the most expensive of the three types of plans. PPOs allow you to get care out of the plan's network, usually at a higher copay or a lower reimbursement rate, but you don't have to stick to the plan's defined network, right? With the PPO, you also don't typically need to get a referral to see a specialist. You can just make an appointment directly with the specialist. So PPOs provide the greatest flexibility, but that'll come at a premium, right? Typically, the most cost-effective plans at a given kind of metal tier are HMOs. So HMOs have a strict network, so you have to stick to the network. If you go outside the network, that's not going to be covered by the insurance. And usually you have to designate a primary care doctor who's going to coordinate your care, right? So you'll have to get a referral from your primary care doctor to go see a specialist. And HMOs use this kind of referral system, and the primary care doctor is the gatekeeper to keep costs under control, right? So less flexibility, but typically, you'll save on premiums. In the middle, if you want kind of a hybrid of the two, are the EPOs. So these are exclusive provider organizations. Again, there's going to be a network that you have to stick to, but you have a little bit more flexibility in that you can typically go see a specialist directly without needing to go get a referral from your primary care doctor. So again, depending on what you value most, do you value keeping costs down or flexibility in terms of network and provider? You're going to have to kind of weigh up those two criteria to figure out what kind of plan that you want.
Now, I like that you talked about how you want to check your doctor and make sure that they're in the plan first, because I think that might be a mistake a lot of people make.
Yeah.
They sign up for a plan, it seems like it's really good, and then they find out their favorite doctors aren't in the plan. And I don't know if this is necessarily within your wheelhouse, but we could throw it out to everybody here. But my issue is, how do you even know what a good doctor is? Like, to me, it's almost harder to find a good doctor than it is to find a good mechanic, right? Because you can talk to your neighbors and say, oh, Joe down the way, he's great with transmissions. But we don't necessarily talk like that with doctors. Like, how do you know who to even find?
So if you go online, there'll be, I've seen doctors on Yelp. I don't put too much stock in that, but there are healthcare specific type rating systems. Like I think Healthcare Grades is one where you can go.
Healthgrades. Healthgrades.com. Yeah.
Which tends to be pretty good. It sounds like I'm endorsing them, but I've used ZocDoc for a while. But they also have patient reviews from verified patients who've seen the doctors. In my experience, it's just who I feel comfortable with, right? Does the doctor listen to me? Does he or she feel credible? Am I rushed? Am I waiting 3 hours before I get seen? All those sorts of things. It's, and I found that referrals from people I trust are, as in anything, kind of always the best source for who I like as a provider.
Yeah.
Well, yeah. I was just going to say, I just moved. I moved back to my hometown, and so when, who do I take my son to? Well, I'll take him to the doctor that my parents took me to when I was growing up, because he's still practicing. And then I asked my mom, who's the lady doctor you go to for your lady things? And so that's who I'll go see. So I think referrals are probably one of your best ways to go about things, especially if you're going someplace where you know people.
And I've also found that if you have one particular doctor that you're very fond of, that doctor can probably refer you to another doctor. That, like if that doctor's good, he might be part of a network or know some other good doctors that are good as well. So you could always ask them for references too. It's not perfect, but at least it gives you a starting point, I think. I just think that it's important to have a good doctor, because if you're not keeping healthy, one, what are you paying for really in your plan? And two, like the whole idea is to stay healthy to keep costs down. So if you're not using it because you're either not fond of your doctor or whatever it is, accessibility, it kind of defeats the whole purpose. So that's just a gripe on my part. Is there a minimum health insurance that's required or that people should look for?
So by law, under the Affordable Care Act, you do have to have a qualified plan, unless you can't afford one and you meet the income criteria, at which case you typically become eligible for Medicaid. For folks under 30, there's a special level of plans available. They're like super high deductible. They're called catastrophic plans. Basically, just to cover you in case something catastrophic happens. But those are only available to people under 30, I believe. So, really, if you're shopping on the Affordable Care Act exchange and not on Medicaid, the minimum is, a bronze plan, which is the lowest tier of coverage. And typically, bronze plans will pay, I think, around 60% of, total health care costs, and you'll pay 40% of that.
Now,
and the thing too is if some people that I've talked to have actually done the crazy thing where they don't get insurance and they just pay the penalty, and if they don't realize that that's actually going up this year too.
Right.
The first year was $95, which that's not a big deal. This year I think it's like $325 if you don't have insurance, and then next year it's going to be almost $700, I think, or 2.5% of income or something along those lines.
Yep.
So.
Yeah, and it's important to note that that's for the people in your household, each person in your household that isn't insured. It's not just like, hey, for your whole family. That's each person in your household that's not insured.
Now, when you say like every kid, every person, or sometimes they don't count kids as full-on people,
Sometimes I don't count my kid as a full-on person. No.
Again, another episode perhaps for another day. But, so like a family of four, you're talking about like 3 and change for times everybody. So that starts to add up quickly then. If we're looking to not get the insurance and pay the penalty.
Yeah, it's capped at something, or was it capped times 3 times, triple the per person tax or something along those lines?
Yeah, I have to look and see what it is.
But I think that's
$2,085 per family in 2016, so, or 2.5% of income. So there you go.
Are there any common misconceptions people have about healthcare that maybe need to be dispelled?
I think one thing that was surprising to me when I learned it was, and this is a money-saving tip, is that something around 80% of medical bills, will have an error on it. So it's incredibly high. I would not be surprised if most of those errors were in favor of the doctor and against the consumer. So it
It's a funny
behooves you.
coincidence
Yeah,
that those
isn't that
errors
funny?
only go one way.
It's never in your favor, right?
No.
Well, I think there's...
$100 box of Kleenex.
That's right.
Just
Well,
had surgery, but here's $10,000. Go for
Yeah.
it. Yeah.
So there's a site called Medical Blue Book that has a list of different codes. Because, when you look at your bill, if you ask for an itemized bill, there'll be all these like just little codes next to it that put in how much it costs. So if you go to this site, you can actually look at it and get a general idea. But one of the things that go along with this cost thing that I was really shocked to find out was procedures cost some different amounts depending on where you go, even the same procedure. And they did a study a couple years ago that even showed the disparity in cost from one hospital to another hospital in the same town was sometimes thousands of dollars. I mean, it was insane. And then of course, if you get something done in a small town versus going to California or something to have something done, then you're going to see a big difference in cost as well. So so being able to shop around, I think, is a big thing.
That seems reasonable, right? Like I mean, if you want the best service, you want the best doctor, it might cost more, right? And it seems like
it has nothing to do with that.
So I mean, so you're saying that some hospitals are just more expensive, maybe for whatever reason?
Yeah, it's arbitrary, and it's even in the same zip code, right? Like there was some study that there was one MRI lab across the street from another MRI lab, and the same procedure was, thousands of dollars different, just arbitrarily. So that's probably one thing that people don't know that they can do, is that you can shop around especially for, if it's not a life-threatening procedure, you need an MRI, you need, lab work done, you can shop around, especially if you've got a deductible and, those costs are hitting you directly.
And that's something that if people have employer health insurance, a lot of times they will provide you with a service or something like that that'll shop around for you. I mean, you can say, hey, I need to have this MRI done. Can you find me a place relatively close to me that is the lowest cost for this MRI? Because it's going to be basically the same thing no matter where you go. So.
And there are a couple health insurance companies now that'll have an online database of that as well. So you can put in like, oh, I need, an MRI or a lab procedure done, and it'll show a list of providers in the network and what the cost is, right? So, there's a big difference between going to an urgent care clinic for something versus, the ER for something, right? And it'll show you what those expected costs are. So, that's probably the biggest way that folks can keep, their actual bills down is, shop around and be smart about, what facility you're going to for, the care that you're seeking.
Now, it's interesting we're talking about shopping around, and I think maybe we're talking maybe on a local level. I've certainly heard a lot about traveling to get procedures done. I think Tim Ferriss talks about this. Like, you go to other countries, and like for the price of getting a procedure and going on vacation in somewhere else, it still ends up being a lot cheaper than just getting a procedure done here. I mean, does anybody know a little bit about that, or how
medical
effective
tourism?
That could be? Yes.
Well, the most, I mean, personally, the only thing I have is my grandpa, who lives near the Mexico border, used to sometimes go to Mexico for his prescriptions, or for his eye doctor appointment, or for his dental appointments. I know people go and have major surgeries in like India or something like that, but the ones that I personally know just went down to Mexico to have dental work and eye appointments and get their prescriptions.
I mean, is that something that's perfectly legal, to just go somewhere and say, hey, you know what, I'm going to have my back surgery done there, or whatever it is? Because I know, like, our friends to the north in Canada, their health care is relatively cheap, or maybe non-existent as far as price compared to us. That's not necessarily something we would travel to, but it's just interesting how other countries have different costs.
With Canada, though, yeah, I think if you were to travel there, you'd probably pay the same, because I don't think our costs are any lower. They're just paid for publicly. But okay. I know, talking to a lot of Americans, one of the misconceptions is that everything's covered for us and it's just this big free-for-all. But really, it's just regular doctor visits and hospital visits and that kind of real necessary stuff.
You can't get like the Kim Kardashian special and just like have done over for free.
Yeah. No fake parts for free.
Okay.
But it was very similar about the specialists. We do need referrals for that. I didn't realize it was to keep costs down. I thought that was just because the doctors knew better than me what kind of specialist I might need to see. But but if you're paying for if you need to see a dentist or get glasses or any of that, prescription drugs, that we pay for, and then it's very similar to some of the stuff you guys were discussing about maybe having employee benefits or paying Blue Cross or Sun Life or something. to get some kind of benefits, because otherwise, yeah, we may not pay thousands of dollars for a hospital visit, but you could pay hundreds of dollars for a small little bottle of pills, and so we still have this need for benefits.
So do you have separate plans for each of those up there as well, or is it maybe on a different scale?
Similar ideas. As far as I know, we don't really use the sort of the gold medal kind of scale, but we have the same thing where you have different tiers, and you might have 80% coverage, 90% coverage, 100% coverage, and pay more to get into those. But in no way does it give us extra access, like how you were talking about seeing specialists directly. You can't buy your way into extra access like that. You're literally just, your insurance is only giving you that extra sort of protection from having to pay for it for yourself. The biggest thing I was just taking in this show so far is it's not that you guys have to pay for it, it's how complicated it sounds. There's all these different plans and insurance and stuff. Ultimately, we're both paying for it because we pay for it through our taxes, and it's not about the money. I think it might just be the simplicity. If you don't feel well, or if you need to see a doctor for some reason, the money equation's out of it. There's no complication. You just go see them.
I think on average for most people, the complications aren't that great. You know, if you're just going to a doctor, you may be just seeing some specialist. Usually you just go there, you pay your copay, and you never deal with it again, right? I mean, I think that would, am I correct in that's what most people's experiences here would be as well? I think for me it gets complex when you either have maybe one office that doesn't have good accounting, or if you have maybe a surgery or something specialty done, and now you have all these different factors coming in, like hospitals sending you bills and different doctors sending you bills. Now the insurance sends one bill, and they're looking to find out if you're double coverage somewhere else, and then it gets very inundating, and you start, you know, this one says that you have to pay this much money, and you have to back it up. Then it gets very complex, which is certainly mind-boggling.
And what you don't want to do is you want to make sure you figure out all this stuff before you need to know it, because
Exactly.
otherwise you end up in a situation where, you know, like 2 years ago with my wife, where she ended up having a massive blood clot and ended up being in the hospital for a month, you know, and we're in the middle of, you know, trying to save her life, but at the same time we're having to think about all these, you know, health insurance issues and if the doctor's covered or not, and you don't want to think about those things when you're dealing with a health crisis. You just want to say, yeah, give her the best of whatever and get it taken care of, which is basically what we ended up doing. And thankfully we had good insurance at the time, and it covered over $250,000 worth of expenses. But
Wow.
you know, that's why you need to sit down beforehand and actually think about, okay, if this scenario comes up, what am I going to do, or whatever.
And that's a crazy thing. Like, I mean, why should anybody ever have to make that thought when something like that is presented to them? You know, like, sorry, honey, you know what? I'm maybe not this year. You know, we can just get part of that liver fixed, or you know what? It's just, it's insane. I had a thought just as I was thinking that, and it's gone. So I obviously have to see some kind of neurologist or something about that.
I'll have all sorts of thoughts, but then I'll start yelling again. So.
So let's talk about maybe other forms of insurance. You know, we talk about healthcare and we think about health, it's everything. But do people need to consider or look into, let's say, like dental, eye? Is there hospital insurance? Are there any other insurances that maybe we need to be aware of that, you know, we're not thinking of?
Sure. So dental and vision are the ones that most frequently come to mind. You know, if you're actually looking at the whole suite of products, they're not must-haves, right? Like, that's kind of predictable. You know, if you wear corrective lenses, what that budget's going to be. It doesn't typically save you too much over just paying out of pocket for it. Same with dental insurance. There's actually dental discount plans, and we did a study of which is actually better for you, and how much money you would save on dental insurance versus the dental discount plans. And depending on the kinds of procedures you have in a year, you know, actually you could come out better either way. But, you know, nobody's ever gone broke over, you know, unexpected dental expenses, right? So if you had to forego dental insurance, you know, the out-of-pocket costs are much more manageable and predictable than, if you have to go to a hospital or, you had a situation that landed you in the hospital for a month, right? One other type of insurance that has been growing a lot in the U.S. and was pioneered in the European and South African markets is like critical illness insurance. And so this is insurance that'll pay you a lump sum, typically anywhere from $20,000 to $100,000 in the event of a critical illness diagnosis. It's typically like heart attack, stroke, invasive cancer, and that'll help, defray the cost. If something like that happens, it's catastrophic. Not only will you have high healthcare costs, but you probably won't be able to work for a while. So these policies have been growing in popularity. Typically, they're pretty, if you're young, good health history, they're pretty affordable. You can get them, anywhere from, 20 to $60 a month, just to have that peace of mind in case. And it's a nice complement to a high deductible plan, right? Because, if you're 29 and, picture perfect health, but you want to have something just in case. A good friend of mine, when we were in law school, she was 29, got diagnosed with very aggressive breast cancer, right? So you never know when that kind of strikes. So critical illness is something that's been growing in popularity, and it's pretty affordable coverage. Disability insurance, usually large employers will offer short-term and long-term disability insurance. We always suggest to folks, particularly at the beginning of their careers, look into disability coverage. It's kind of the one thing that people forget about. Everybody always thinks about health insurance. And when you get sick, particularly, with cancer, things like that, it's not just the hospital bills, but it's the fact that you can't work for, 2, 3, 4 months, right? And once you exhaust your paid time off and your sick leave, then you're without a paycheck. And actually, extended medical illnesses, there was a Harvard study done a few years ago. It's the #1 cause of personal bankruptcy filings, was the big driver behind home foreclosures, is people who were, unable to work because of an extended illness, right? So disability insurance replaces your paycheck if you're unable to work. So that's a big hole in the safety net as well. So when you're thinking about health, it's not just, the hospital bills and the medical bills. It's also, what if you can't work, right? Which is, something that happens much more frequently than we like to think about.
I'd imagine that similar to just life insurance, a lot of people probably don't take advantage of that when the costs are low.
Yeah, exactly. And the younger you are, especially on disability insurance, if you lock in a policy when you're young and you're healthy, you can actually lock that premium in for your whole working career. So the contracts, if you get a non-cancelable one, you actually lock in that premium for the duration of the contract, as long as you pay the premium.
It sounds definitely something that people should investigate. That does sound good to be able to lock in a low cost there. Now, you're talking about just coverage for long-term care and for other coverages like a cancer type of thing or catastrophe. Is that something where like a company where like an Aflac or something like that comes into play?
Yeah, so Aflac is probably the most well-known provider. They only provide through the workplace, so they only do group plans through employers, so you can't individually, go and get an Aflac plan. But there are individual providers of critical illness, disability insurance, so you can go and get, one of those policies to supplement your health insurance. And it's something that's advisable, one, if you have kind of low savings, as well as a high deductible plan. So, that's something that, think about the things that would trigger you needing to pay your entire deductible. It would be something that lands you in the emergency room or a catastrophic illness. So, those can be good supplements for low savings and a high deductible plan.
Now, we talked about bills and how complex it could be a little bit earlier. How negotiable are doctor bills? Some people say, especially in the personal finance realm, negotiate everything. Are doctor bills, doctor visits, procedures, are those negotiable as well?
I'm a terrible negotiator, but they actually are. I've read a study that, something around 50% of the time, if you ask for, your doctor for a discount, you'll get something. So it doesn't hurt, right? And they are deductible, or they are negotiable. And typically a doctor, because they have to deal with so many different payers, insurance companies, Medicare, Medicaid, they basically have a different rate schedule for the exact same doctor visit and procedure, right? So, if you, for example, want to pay out of pocket so his office doesn't have to deal with the insurance company, you might be able to get a better rate. So it certainly doesn't hurt to kind of ask and negotiate if you can get a better rate on the services.
Yeah, one thing I've always found a little crazy is when you do see some bills, it tells you what the doctor's office asked for and then what they get.
Yep.
And they're like, oh, we like a dentist might say, oh, we asked for $300 per filling, and then the insurance covers $25. And you're like, well, what's this disparity? it just seems just another inefficiency in the system. Like they're just automatically asking for so much money. So it makes sense that you can negotiate it because it's sort of built in that there's going to be some fluff, for lack of a better word. So Jennifer, is there anything else that you think the average person needs to know about insurance that maybe we haven't covered?
No, I think we've covered a lot of it. The other thing we didn't touch on is, in addition to negotiating and asking your doctor for a discount, drugs. The big cost saver is using generic drugs when you can. And there are a lot of like pharmacy discount programs you can sign up for. Mail order prescriptions are typically cheaper than going to a pharmacy to fill it. And you can even actually shop around different pharmacies, right? So, not all pharmacies are created equal. So you can actually, shop around for pharmacies as well to see, on your prescriptions where you're going to be better off.
Is there legitimacy if I see something online that says, cheaper, whatever, to that? Are there legitimate companies that work online? Or am I just seeing like some weird kind of scammy ads?
You might be seeing both, but there are certainly legitimate mail order and online ordering for your prescription drugs.
Okay, so you got to do your homework and your research, as with anything, I guess.
Yeah. Or the herbal Viagra from China. That's not legitimate. Look, I got an email once from this guy in Nigeria, and I got burned on it. So now I'm a little skeptical when I see any others.
Selling you Herbalife.
Yeah. So I just got to throw it out there just to be safe. One thing we do on the show here is we like to wrap up with a final word. So our final word on saving on health costs. We'll start with our Canadian, who maybe just by nature of where he lives is his final word, but we'll see. Tom, what's your final word?
My final word is just to plan ahead. Like here in Canada, it is just sort of, do you have employee benefits? And if not, maybe look into some other insurance. Down there in the States, sounds like you have a lot more planning to do. But certainly, Pete mentioned it too. You don't want to have to wait till you're in the situation to figure out what you should be doing and how you have to handle everything. So like with any insurance or any kind of planning, just do it ahead of time when you're a little more clear of mind.
Peter, your final word on healthcare costs?
I kind of already mentioned it, but yeah, just sit down and think about these things before you have to. A good time to do it is during the enrollment period for your company's plan, if that's something you have. Sit down during that time, figure out what you've paid for healthcare costs in previous years, and kind of go from there. Figure out what your healthcare needs going to be, and then choose a plan based off of that. So think about all these things before you need to.
Miranda, what's your final word on healthcare costs?
Yeah, I think one of the things that we didn't touch on a whole lot are the payment plans that sometimes different medical places offer you. Before you get into a payment plan, make sure you understand what is involved, because in your mind you're probably thinking, oh, it's just, I just divide it up. If it's, $200 and I need to pay it off over 4 months, it's just $50 a month, and that's what you're thinking in your mind. But a lot of the time, these guys are actually extending you a line of credit, and it's a loan. And so you definitely need to be aware of what your payment options are and what's really happening when you agree to a payment plan. And this happens a lot, especially with dental visits right now. So pay attention to what's going on and the payment options you have, and make sure you understand whether you are actually getting a loan or whether you are setting up an installment, a non-loan installment plan.
Good advice, because I imagine if it's something like a credit loan, you could be paying maybe 20% or so, right? Just similar to a credit card.
Or you may not even realize that it's a loan, and if you miss a payment, well, there goes your, it's going to impact your credit score. Not as much because, well, anyway, that's a completely different episode. But yeah, I mean, it'll affect a lot of things if you're not careful.
And Jennifer, if you'll close out a final word on best ways to save on healthcare costs.
Sure. I think just be realistic about what you'd like to pay and what you think you're going to pay. The sad thing with healthcare is you're going to pay something. You're probably going to pay more than what you'd like. So be realistic about that. And, think about what causes you more stress. So kind of a high fixed cost or a high unpredictable cost, right? And let that guide your decision, and just kind of take it as a given that you're going to pay something, and just make the best decision optimizing around that.
Thanks so much, Jennifer. For those people out there, can you tell us a little bit about what you do and a little bit about Policy Genius?
Sure. So I'm the CEO and co-founder of Policy Genius. We're a company that's been around for a couple of years, and our mission is to make the process of shopping for and getting advice and buying insurance as easy as possible for the digital consumer. So we have created great content. We've got advice tools online. We've got instant quoting for a lot of products, not health insurance yet. That's one of the new products that we'll be adding in the upcoming months, but we've got life insurance, disability insurance, a few other lines as well, and we really want to take this whole mystery and pain and frustration and stress around insurance, demystify it, make it transparent, and make it easy to just, get what you need for your family and just get on with life.
Thanks a lot, Jennifer, and thank you again for sharing your knowledge with us and our viewers. And for everybody out there, until next week, be good with your money. Good night.
Thanks for joining us on the Money Mastermind Show. Get more information at moneymastermindshow.com. Don't forget to subscribe to the show on iTunes and YouTube, and follow us on Google+.